So I chose to do scenario 2, which is Mrs. S is a 72-year-old retired school teacher. She lives alone with her dog Ginger and is very independent. She was shoveling snow on Monday morning after a big snowstorm. While shoveling the snow, she developed a crushing sensation in her chest. This is not the first time she has had chest pain. Mrs. S has a history of angina, though she has never had a heart attack. She takes aspirin every day at home and keeps nitroglycerin tabs in her pocket just in case. Mrs. S took the nitroglycerin tab and an aspirin and drove herself to the hospital. Mrs. S was admitted to the hospital Monday afternoon with chest pain, rule out of a myocardial infarction. She has been on a patient on cardiology for 4 days now. She has no chest pain since Monday and has been ruled out for a heart attack. She has an IV of 95 NS to keep open and expects to go home in the morning. At 2200 hours, Mrs. S put her call light on. Her nurse, Sue, RN, answered the call light. Mrs. S stated that she was having chest pain and rated it a 9 out of 10 on the pain scale. Sue, the RN, had the PCA check her vitals and get an EKG. Sue went to get her nitroglycerin tab. Mrs. S' blood pressure was 90/52. Her EKG shows ST changes. Her heart rate was 120. Her breathing was labored at 36, and her pulse oxygen was 85% on room air. She gave Mrs. S a nitroglycerin tab sublingually. There was no relief to her chest pain, and her blood pressure decreased to 80/52. Sue placed Mrs. S on oxygen at 21 liters, and her pulse ox improved to 91%. Mrs. S is very anxious and states she feels terrible. Sue increased her IV fluids to 100 cc per hour and called the physician. So the situation would be me calling the doctor. So, doctor, this is Ariane calling from the cardiology floor. I have Mrs. S here, a 72-year-old patient who was admitted 4 days ago for an episode of angina. We have ruled out a myocardial infarction. She has not had any chest pain since she was admitted on Monday. However, at 2200 hours, she started having chest pain again, and that she rated a 9 out of 10. Patient is anxious and states that she feels terrible. The background of this patient lives alone and states she is very independent and is a retired school teacher. Monday morning, she experienced crushing sensations in her chest as she was shoveling snow. Patient has a history of angina and takes a daily aspirin, as well as she keeps nitroglycerin tabs in her pockets. Patient has never had a heart attack before. The patient states her chest pains are 9 out of 10. Her blood pressure is 90/52. Her heart rate is 120. EKG shows ST changes. She has labored breathing at 36. Pulse oxygen levels were 85% on room air. The assessment. Nurse gave her nitroglycerin tabs sublingually, no help, then BP decreased to 80/52. Gave oxygen at 2 liters. Her pulse oxygen improved to a 91%, and she increased the IV fluids to 100 cc per hour. The recommendations: labs are likely needed, and I would need the doctor to come evaluate the patient right away. What were your thoughts on the clinical scenario? When I first started reading the scenario, I thought it would be likely that Mrs. S was going to end up having a heart attack. However, she was brought in with angina. I would still think we would need to discuss with her how often she has these attacks, and what alternatives we could find for her to aid her, because she lives alone and it seems like these attacks are becoming worse. What do you think could have been added to the SBAR? I honestly think that the SBAR does a great job hitting every key point, but I do think the only thing that I would add is a plan for her after treatment. What do you think we did not need in the SBAR? Personally, I think that the SBAR gives proper patient care, and I don't think that anything should be subtracted from the SBAR. If we did this conversation again, what should we do differently? I personally would like to gather more information on the patient, like how many of these attacks she has had in the past, when she was diagnosed with angina, and if she sees a cardiologist. I believe it is important to know the severity of her case and to find out if she has any other health problems at hand that could link to her angina. Do you think the significance of the situation was clearly presented to the physician? I believe the physician would have enough information to know the state of the patient, what state the patient was in, and how severe it was in order to know exactly what their next steps would be to providing patient care.